Beconase Aq Aerosol spray contains beclomethasone, which is used to prevent and treat seasonal and year-round allergy symptoms such as stuffy/runny nose, itchy eyes/nose/throat, and sneezing. It can also help with symptoms caused by other triggers like cigarette smoke or perfumes. Additionally, it is used to prevent the return of growths in the nose, nasal polyps, after surgery. Beclomethasone belongs to a class of drugs known as corticosteroids and works by reducing inflammation in the nasal passages. For best results, follow the recommended daily dosage and use it at the optimal timing for your symptoms. Before using Beconase Aq Aerosol spray, be sure to read the instructions provided by your pharmacist. Use this medication in the nose as directed by your doctor, usually 1 or 2 sprays in each nostril twice a day. Remember not to spray it in your eyes. Make sure to blow your nose gently before using it. It's important to shake the container well before each use and follow the instructions to properly prime the spray pump. To use the spray, remove the safety clip and plastic cap. Close one nostril by pressing it with your finger. Tilt your head slightly forward and insert the nasal applicator into the other nostril. Press down firmly on the pump to deliver the prescribed number of sprays. Breathe in gently through your nose and out through your mouth. Wipe the applicator tip and replace the plastic cap and safety clip. Avoid blowing your nose for 15 minutes after using this medication. The dosage is based on your medical condition and response to treatment. Use this medication regularly at the same times each day in order to get the most benefit from it. Do not increase your dose or use it more often than directed. It's important to note that this medication does not work right away. Some people will feel it working within 3 days, but it may take up to 2 weeks before the full benefit takes effect. Ask your doctor or pharmacist if you should also use other medications along with this drug until it takes full effect. Keep track of the number of sprays used from the bottle and discard the bottle after you have used the specified number of sprays. Do not pour any remaining medication into another container. Follow the package instructions to unblock the spray tip if needed and to clean the spray bottle. If your condition does not improve after 3 weeks or if it worsens, be sure to inform your doctor. Some of the common side effects of Beconase Aq Aerosol spray include nose/throat dryness or irritation, sneezing, nosebleeds, nausea, and an unpleasant taste/smell. If these side effects persist or worsen, it's important to inform your doctor or pharmacist right away. It's important to note that this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any serious side effects such as loss of taste or smell, pain/sores in your nose, unusual/extreme tiredness, weight loss, headache, swelling ankles/feet, increased thirst/urination, vision problems, or signs of infection like a sore throat that doesn't go away, ear pain, fever, chills, or white patches inside the nose or on the back of the throat. While a very serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or wheezing/trouble breathing. Remember, this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. Before starting to use Beconase Aq Aerosol spray, make sure to inform your doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Also, before using this medication, inform your doctor or pharmacist about your medical history, especially if you have eye problems, infections, or recent nose problems. It's important to stay away from anyone who has an infection that may easily spread, and to talk to your doctor if you have been exposed to an infection or for more details. Rarely, using corticosteroid medications for a long time can make it more difficult for your body to respond to physical stress. It's important to inform your doctor or dentist if you are using this medication before having surgery or emergency treatment, or if you get a serious illness/injury. If using this medication for a long time, it may temporarily slow down a child's growth, so it's important to see the doctor regularly for your child's height to be checked. During pregnancy, this medication should be used only when clearly needed, so it's important to discuss the risks and benefits with your doctor. It is unknown if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware that Beconase Aq Aerosol spray may interact with other medications, which could affect how they work or increase your risk of serious side effects. Be sure to keep a list of all the medications and herbal products you use, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. Be cautious when using other corticosteroid medications, such as prednisone, as they may increase the risk of side effects when taken together with Beconase Aq Aerosol spray. It's best to carefully check all prescription medicine labels and consult your doctor or pharmacist if you have any questions. If someone has taken too much Beconase Aq Aerosol spray and is experiencing serious symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important not to share this medication with others, as it is specifically prescribed for your own use. If you are using the Beconase Aq Aerosol spray for a prolonged period, your doctor may recommend lab or medical tests to monitor your progress. This could include nose exams or measuring the height of children. It's important to keep all medical and lab appointments and consult your doctor for more details. Additionally, it's best to avoid substances that can worsen allergy symptoms, such as pollen, pet dander, dust mites, mold, and smoke. This can help to ensure the medication is as effective as possible in managing your allergy symptoms. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. Make sure to store Beconase Aq Aerosol spray at room temperature with the safety clip and protective cap in place, and keep the container upright. Keep it away from children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.